Today's topic, I want to talk to you about sensory nerves. And sensory nerves are how we feel. So, like if you touch something hot with your hand, touch a stove, touch something, hot cup of tea, and that's called a sensory nerve. Something we don't really think about until it's damaged. So, hot, cold, light touch, deep touch. We have pressure sensitivity. We have like things that, if they're a grip around us, like our socks around our ankles. Most people don't notice that until they have like swelling in their legs or they have a problem. And then like when people get pain and they get all these different like numbness, tingling, those nerves are damaged. Only a nerve will tell you something's wrong like that. Pain, numbness, tingling, burning. And if you're cramping at night, that's a whole nother metabolic inflammatory problem that the nerves are not getting what they want, so they're cramping. I explain like static in your phone. It's a signal when it's not supposed to be. It's supposed to be a nice smooth signal. It's jumping. That's cramps. So there's some metabolic issues there too. So but the sensory nerves, people don't understand when a nerve gets damaged, it doesn't have to be 100% damaged. I call it a 49%er. You can have 49% damage and still live your life, and you get symptoms sometimes. You think, oh, it's not all the time. And that's human nature, right? It's not all the time, so let me live with it. Well, I've done that. And then when it gets right above that 50%, it becomes a 51%er. You can have way more consistent problems. You're like, well, it wasn't that bad, now it's getting worse. And we as humans are meant to survive, and you'll compensate all the time. You'll figure stuff out. And I've tested people that have sensory nerve damage in their feet, and they also start having knee problems. And they're like, I've had plenty of people go get knee surgery, and there's times for it, don't get me wrong, but they come into my office and I test them, and I'm like, well, all the nerves, or a majority of the nerves around your knee, they're called myotomes. I test them and they can't do things. Like they can't rotate their leg in, they can't hold their leg straight, they can't push their legs out. And that's because we're testing the different nerves the body can't hold up. Okay. And so my biggest thing is like there's so many ways to heal nerves now, like photobiomodulation, which helps give blood flow and oxygen. But there's specific machines I use that have specific frequencies and wavelengths. There's specific nerve stimulators that help regulate the nerves and wake the nerves and regrow the myelination. Then we have other fancy machines like Shockwave, which helps cause the stem cells to activate and give 300% more oxygen to the nerves. And then we have what's called StimPod. It's a newer machine that's been shown to actually help regulate the C nerve fibers to calm down. Because what happens when you get damaged is these specific nerve fibers go upregulate, and the other fibers, which are like touch receptors, and they go down. And the way I explain that is like if you hit your thumb with a hammer, you would rub your thumb automatically. You don't even think about it. Because touching, which is called proprioceptors, override pain receptors, which are called nociceptors. So these C fiber nociceptors, this machine, the StimPod, actually helps take down those C fibers and upregulate the other fibers, the A fibers. And what that does is actually cause your nerves to start to heal. And when we use all these things together, we're actually reversing nerve damage. We're actually fixing the problem. I want to make sure I say that again. We're fixing it. We're not covering up with a drug like gabapentin, Lyrica, Cymbalta, Neurontin. We're actually getting to the core of a problem and giving the body what it needs. And when you give the nerve what it needs, blood flow, oxygen, nutrition, stimulation, blood flow, oxygen, nutrition, stimulation. You give the nerves what they need. I've had people heal with all kinds of diagnoses who were told they would never heal. From Jillian, who was 9 years old. St. Jude said she had Charcot-Marie-Tooth syndrome. It's genetic. She'll never walk. And she started with foot braces. And if you go to our website, you'll see we have pictures of her doing cartwheels and her doing gymnastics again, which she doesn't do anymore, but she got to do it again. She went from wearing foot drop braces, which were all nice and pretty and colorful because she was a young kid, to she doesn't need them anymore. And St. Jude had given her gabapentin. And I can talk about that because the mom made a commercial with me, with Jillian. How she thought her daughter was going to be in a wheelchair. And now she got to come and play. And I have 4 kids, and I get it. Like, when I got sick, all I wanted to do was be able to make sure I'd be able to walk my daughters down the aisle someday and be able to play with them. Because you don't think about this until it's gone. And that's really where I'm at with health, is that people, until it's gone, you don't think about it. I've heard people say, like, you'll give up your health to work and work and work and make money, but then when you get older, you're going to have to spend all your money to get your health back. How about we do it more consistently? Like, I'm 50 years old in August, and a stat I just heard was people 50 years old in this country in America are on average on 5 meds. 5 different meds. This is what makes me mad, because like with health insurance, I can't take a test and say I'm healthier than everybody. I don't take any meds, I exercise, I test myself, I do things, I stay in shape. Well, they raise my rates based on, so I think insurance is a little bit of a game that is set up for failure for most people, like me, who take care of themselves. But I'm not expecting to take meds. And I'm not saying there's not a time and place, but I feel like, let's talk about numbers for a second. We're 5% of the world's population, but we take 70 of the world's medications. And we're still the sickest country, the most heart attacks still, even though we take a lot of meds, heart meds, statins, all these things are supposed to prevent heart disease. We're still number one, baby. Number one, America. We still have the most obesity, even though we have all this Ozempic and all these things that now we have a pill magically. But I've actually had a patient who was taking a GLP-1, which is what Ozempic is, and all these other ones, Mounjaro, all these names. And he went to Mayo Clinic and they caused neuropathy. He went from a normal, healthy person to a walker, where he actually had drop foot. And I got his symptoms better, his pain, his tingling, and his numbness, but the damage had been done in some of those nerves. And that's a GLP-1 they gave him. And Mayo Clinic said they've been seeing this, so it's I don't know if they're overdosing, I don't know. Because I've also seen people talk about how some low doses of things are good, but I think we're overdosing people and not giving them a responsibility to take control of their health and eat better. Because we have a diabetic reversal plan in my office where we get people off their medications, off their metformin, off their drugs, and they can keep it that way because we want to actually, your metabolic system, diabetes, type 2 diabetes is not a disease. Like, it's not like genetic. It's not, because it used to be adult onset and we changed the name because kids were getting it. Kids are getting type 2 diabetes. Like, that's crazy. Like, we have more obese kids. We have a generation of kids that are not supposed to live as long as their parents. That's never happened. Like, usually it's kids do better and always do better than their parents. But that's not happening now. I want people to, I want the light bulb to go on and say, hey, something's wrong. And I think more people are catching on. That's why I make these videos. There's so many people I've helped, and like, the standard medical model is we'll do an MRI, we'll do some shots, we'll see what happens, we'll play, and all that is cover up. We're playing the cover up game. You know, there's a problem in my hand, let me cover it up. Don't look at it, it's not there anymore. It's still there. Take my hand away, it's still there. Well, let's cut it out. That doesn't work either. Nerves want to tell you what's wrong. They're telling you a story. Pain, if you had pain, numbness, tingling, or burning more than 2 weeks, it's not a muscle, and it's not arthritis. You may have arthritis, but it's not arthritis because the body doesn't constantly give you these symptoms without trying to tell you something's wrong. And the reason I say that is I've had people, some of the most horrific x-rays I've ever seen, feel better. I've had people with bone-on-bone knees feel better. And so we actually help the bone-on-bone, we help the meniscus, and we have a knee decompression machine, we have shockwave machines that help that. The stim pod helps that. So all these things we do, and the stuff I do with sensory nerve re-education helps that. But you have control of your health. It's just people in this country have been told a lie that you can just trust the medical model to teach you what to do. Well, if you look at the rates of what they do, I'd be out of business if I did what they did. If they were the sickest people in the world and we're still having problems, you know. I saw my own family members. They got cancer treatment for a thyroid and then they ended up getting brain cancer afterwards. There's a secondary cancer. There's things that happened. And I was like, can we try other stuff first? But they, you know, it's a pretty common route. You know, cancer is pretty serious. And I say cancer will kill you, and it will. Neuropathy won't, the things I treat. Neuropathy will just make you wish you were dead. It'll make you not be able to do the things you want to do. It'll make you not be able to play with your grandkids, or go on vacation, or play golf again, or go hunting, or all these things you've always wanted to do. Now you say, I'm going to retire. I've had people wreck their cars, their collector Mustangs, and not be able to enjoy the things. You know, I had a guy who had 5 Vipers, but he couldn't drive them. 5 of them. That's not cheap, but he had earned it throughout his life. But then now he was retired and his health was tanking. So now, what do you want to do? You want to sell one of your Vipers, or you want to keep them all? It's worthless at that point. It's like, and on my deathbed, it's not, can't do anything with it. You know, I watched my stepdad, same thing. He got sick. He loved hunting, but he could barely walk some days and breathe. Like, really nice hunting equipment, and I wish the best for everybody, but we got to do work before it's too late, you know. The me now who's going to work out today is investing in future me, 70-year-old me, God willing, 80-year-old me. That's what there's a guy at the gym. He's 82 years old. He works on my wife. He does stuff that I've had a hard time doing. He can crawl, bear crawl with a ball on his back. He doesn't want it to fall off because he can't tilt, and he can do it. So keep that in mind when we talk about health. So sensory nerves is what we test. So we'll do hot, we'll do cold, we'll do light touch, we'll do deep touch. I do vibration because that's balance. That's a balance nerve. I have a woman right now, Lee, who after her surgeries couldn't wear socks, couldn't wear shoes, and could barely wear pants. She was on a walker, and now she can wear socks and shoes and pants because we help the sensory nerves rewire to her brain. Because once you damage a nerve, the brain clicks on differently. The survival brain clicks on. So we have to rewire the whole nervous system. It's not just pain here, problem here, let's fix this. A lot of times it's fix this and fix this. So the whole nervous system, the whole loop to the brain, the amygdala, the survival brain turns off. And there's a lot of techniques I've had to use. Like I use biofeedback machines to help some of these people. I've had to use specific devices that are designed for vagus nerve stimulation. I have to use all these special cranial nerve techniques I've used. So I've learned all these because I've seen them in people, and I'm always willing to go learn anything it takes to help people. Because I was that person who was sick and I just wanted to get better. Just tell me what I have to do. And here I am better. I'm about to go run, about to go lift weights, you know. I'm actually stronger now. I can do more now than I did when I was younger. I can bench more, I can run more. I'm not trying to brag, I'm just trying to say age is just a number. People think age. You know, I did an Ironman with a guy who was 20 years older than me at the time. So he was 50, in his 50s, and I was in my 30s, and he beat me. It had nothing to do with age. It had to do with he took care of himself. He was in very good shape. He ate well. He did things. So, sensory nerves, if your body's giving you some kind of symptom, tingling, numbness, burning, leg cramps, loss of balance, you're having pain that's not going away, more than likely your sensory nerves are damaged. And surgery can do it. I've seen people post-surgery, even the anesthesia they give you can cause concussion brain. I've seen people, those are the two young people. Lee, post-surgery, the nerves, the pain fibers. We have fascia that we cut. We have to cut through fascia. And people don't understand fascia is all this connective tissue. Well, when you cut it, the nervous system can remember. It doesn't know the difference. It doesn't know a scalpel. Okay? It can see it like a lion's tooth, and it just sees trauma. Just because they cut your tissue and they try to fix it, the nervous system can remember trauma. We have to go and rewire that nervous system. Well, there's no medicine that does that. There's no pill that does that. All it does is band-aid it or cover it up. Most of the drugs they give you, especially the ones I see most of my patients, the pain pills, the cortisone shots, the gabapentin, the Lyrica, the Cymbalta, those are just covering up the brain signals. It's just putting a sign over the check engine light. It's like a little baby. Ah, peekaboo. It's not there anymore. It's still there. Babies know that, but for some reason as adults we don't understand that. I think we're catching on. I think we're starting to realize that. And that's when people come find my office, because that's what I had. I had pain in my heel, I had numbness in my ball of my foot, my toes. I would have pain in my left groin area. My back would hurt. So I had all these different symptoms. Numbness to pain to tingling. My hand would go numb. I couldn't feel things here. It would hurt here. My grip strength would hurt. The joints would hurt. That was inflammation. And once I solved all those problems, all that went away. So keep that in mind. If you're having problems, 1 Degree Functional Health, we do free phone consultations. You can call my office at 309-698-2500. And we can see, and you actually talk to a real person, not AI, a real person. So God bless. Have a good day.